Okay, when placing an NG tube, you're going to need several things. I always highly recommend a chuck, the nausea basin of the patient. You're going to need your Salem sump, the 50 to 60 cc syringe, some lube, your litmus paper strips, the reagent, I guess, for your litmus paper, a permanent marker, some preferably silk tape, usually, scissors in case you can't rip the silk tape with your fingers, and of course you're going to need your stethoscope. Okay? Foaming in. Hi, Mr. Smith. It's Tammy, your nurse for tonight. I just spoke to the doctor and you need an NG tube. And that's one of those tubes that goes down your nose and into your stomach to drain your stomach, okay? That all right with you? Let me just clean my hands real quick. And luckily we have all of our supplies already here. And we're going to borrow your cup with your straw, because we'll need that. And I'm glad you're sitting all the way up, because we need you sitting as high as possible to prevent aspiration. That's the greatest risk here. We don't want anything going down your breathing tube instead of down into your stomach. So I'm going to put on some gloves real quick, and we're going to take a look at your nose. Have you had any nose surgeries? Anything like that?
No.
Okay. Looks like we can use either side if that's okay with you. And then I need to take a listen to your stomach. Alright, Mr. Smith, I need you to take a few sips of this water. There you go. It's about 3 ounces of water that we're using to make sure that he can swallow prior to this so that we don't have any aspiration.
I can find the fucking.
So, first we're going to open our Salem sump. I usually don't take it out of its little plastic. And then we're going to open the large syringe because we're going to need that. We're going to need some of the lube. We're not going to use that right now just to make sure that we don't get it all over our participant here. And then, so what you're going to do is we're going to spread this out real quick just in case they start vomiting so we don't make a huge mess. Have our nausea basin here as well. Alright. So, you're going to take your, they're called sometimes Salem sumps, NG tube, and you're going to measure it first. We're going to measure from the tip of the nose to the earlobe, down to the xiphoid process, and then you're going to go look. You're going to kind of extend it so you down to the umbilicus, and you're going to see how far it goes. Halfway between the umbilicus and the xiphoid process is what you're going to add to that tube length. So if, say, you're going to 55 at the xiphoid process and 65 at the umbilicus, then you're going to put the tube down to 60, okay? So in this case, it looks like mine is hitting the xiphoid process. This one doesn't have numbers, it just has notches. So what I'm going to do is measure the notches in between. So I'm going to take the permanent marker and mark that spot. So that you can see it really well. Okay? So we're also, we've already marked the tube, but because you guys are new to this, we're going to, as an alternative way of marking the site, we're going to make this little flag here. so that you don't forget and keep going, because it's not pleasant. So you're gonna open up your jelly, and you're gonna lube it up pretty well. You don't want all of the contents or 2 of the contents on here because it's too much, but you want just enough. All right. So you're going to, generally I place my hand on the back of their neck, and this kind of supports, and it also help them remind them to sit up straight. This way also, if they start fighting it, you can keep going. So you're going to tell them, Mr. Smith, can you stick your neck out just a little bit for me, kind of extend it a little bit? So as they extend it a little bit, you're going to start to put it into the nose with a little bit of upward pressure, and you're going to start going down. Patient is going to start gagging at this point, and you're going to say, put your head down, put your chin to your chest, and here, start taking some sips of water. Sip, swallow, swallow, swallow. Keep swallowing, you can do it. Keep swallowing, keep swallowing. Okay, we're there.
5.
Okay, we're going to go ahead and aspirate the contents, about 10 to 20 cc's. And then you're going to pinch it off so you don't spray the stomach contents. Put it in your container for testing. You can go ahead and connect your syringe again. Take your litmus paper and test. And your pH should be less than 5, or if you're doing the bilirubin test, it should be greater than 5. So you can go ahead and disconnect as long as you have your syringe attached. And you're going to take your tape. You should have one tape that is cut down the middle like this and has 2 legs. And you're going to place that.
Go.
Alright, you're going to place that on the nose and one on each side of the tube. And I kind of bring this one up here to stay out of my way. And you're going to wrap this around the tube like this. And then you're going to take the other one the opposite way and go around. And then you'll take one of these and you go across that, kind of to make sure you're pretty secure. And then you take the one off the cheek, and you can use this tape to secure it to the gown so that it makes it even harder for the patient to pull it out. So you want to have them move their head a little bit and make sure you give them some leeway, and you can tape it to the gown. Make sure the gown is on properly, and educate your patient about being very, very careful about not pulling it out. So we're going to pinch right here, put the connecting piece so that we can connect it to the suction.